So, hi, I'm Sam Porter, just come in towards the end of a PhD at UCL, supervised by Daniel, Simon and Chris here. I'm going to present today a bit of a side project that I've been doing in my PhD, looking at accelerating joint PET SPECT CT reconstruction with synergy-aware preconditioning and variance reduction. So as you'll have seen many times over this, this conference, we can model our PET and SPECT reconstructions by creating an objective function where we forward project an image estimate, add some additive data and compare this to our measured data, and then add a regularization term in order to deal with ill-posedness and create an objective function. And if PET and SPECT or any of the multiple radionuclides, if you're working with them, are reconstructed separately, then you and these are injected into the same patient or are part of the same radionuclide, then you throw away a lot of joint structural information between those two different modalities or nuclides. And so what I've been working with during my PhD is yttrium-90, which emits some positrons and some Bremsstrahlung photons, which can be imaged with SPECT. And so we have these two different modalities with the same underlying structure. And we've been looking at trying to reconstruct synergistically to make these two different modalities complement each other. And so to do that, we've been creating a joint objective function here, where we synergize using a joint prior, which promotes structural information between these two different priors. And we're using something that we're calling weighted directional total nuclear variation. So we construct at every voxel a matrix of stacked directional gradients. We weight these to account for differences in scale between PET and SPECT. And then we apply what's called a nuclear norm, which sums up the singular values. And then if you reduce the amount of singular values, you're basically reducing the rank of this matrix and promoting similarity between the directional gradients between these two different modalities. And we smooth this as well in order to give us a differentiable prior, which we can use with gradient-based reconstructions. And so this quite complicated prior gives quite complicated curvature. And so the point of this small evaluation is to see that if we can create a preconditioner that means that we can reconstruct without a prohibitively long and difficult reconstruction process. So the reconstruction step that I'll be focusing on is projected gradient descent. So preconditioned projected gradient descent, sorry. So for the data part of our objective function, we have quite a nice preconditioner that we use with typical EM type reconstructions, which basically majorizes the expected Hessian of the Poisson log likelihood function. And the difficulty comes in trying to find a decent preconditioner for our the prior part of our objective function. And so for guaranteed descent with the unit step size, what you would want would be a preconditioner which used a Hessian that approximates the a Hessian approximation that majorizes your prior curvature. And then you can sum these majorizing curvature approximations and use these to form a preconditioner. We approximately majorize our prior curvature. So what we first do is redefine the prior in terms of a gram matrix here. And then you can construct a quadratic surrogate to estimate an upper bound for the curvature in your Jacobian space, in this stacked gradient space. And then this gives you a big, scary, huge Hessian approximation. And what we can do is ignore some of the off-diagonal terms in this huge Hessian, pull this back to image space, and we end up with a preconditioner that looks something a little bit like this. So we've got kind of a PET weighting, a SPECT weighting, and then these cross-modality coupling terms. And then where do we go from here? How do we construct a preconditioner out of this? So the first thing we can do is to keep this as a 2x2 matrix at every single voxel, and then this just needs inverting to get our preconditioner from the previous slide. We can construct an approximately majorizing diagonal where we involve these cross-modality couplings on each diagonal element, so we just have a weighting of our PET and our SPECT, and we can also just throw away the cross-modality coupling and see if we really need it. And so for our experiment, still in its quite preliminary stages, we test 4 different preconditioning strategies. So this block diagonal matrix, where we use this majorizing diagonal, where we involve the cross-modality coupling terms, and then where we throw away these cross-modality coupling terms, and finally just with our EM type preconditioner. What we did was look at 10 epochs of SVRG initialized with an OSCM with some Gaussian smoothing, with 2 initial step sizes of size 1 and 2, some step size relaxation, and 5 repeated runs with our preconditioner updated once per epoch. So to kind of look at how well this would work if you applied this to a clinical setting with kind of the time lengths that would be appropriate in a clinical for a clinical reconstruction. And we compared this to what I call a converged reconstruction. So this is with 5,000 epochs of SVRG, with 4 restarts, a slightly lower step size, smaller relaxation. And again, this preconditioner updated once per epoch. The data that we looked at was some anthropomorphic phantom data measured at NPL on their AnyScan trio. So this does a SPECT and a PET scan on the same system, which is quite neat. And this phantom has a warm liver compartment, a cold background, a hot sphere, which you can see on the left here, and a cold sphere, which you can see on the right there. And these are the reconstructed images here. So you can see with each of 90, it's a difficult problem. The PET is very noisy. The SPECT is kind of degraded from Bremsschalen. And so it's quite a good use case for synergistic reconstruction. And so we compared the normalized root mean square error in each volume of interest at every iteration, and kind of tracked how these converged over 10 epochs. Okay, so firstly, comparing the kind of speed of these priors. So this is by no means optimized, and it's just done on my computer, but kind of gives you an idea of how long these different things take. So at the bottom, we've got the EM type prior, which it's got a pre-computed sensitivity matrix in the denominator, so it's very quick. And at the top, the most expensive prior. So this involves finding the inverse of the 2x2 matrix at every single voxel, and so you can see it takes about 6 times as long to do. But we only update this once per epoch, and compared to forward projections with PET and SPECT, it's pretty insignificant. So these are some reconstructions after 10 epochs using all of our different preconditioners with initial step size of 1. The first thing to see is that they're visually very similar, which is good news for any potential clinical use, but maybe bad news for this experiment if it really doesn't matter. And we can see with the quantitative results that possibly, at least for this particular phantom, the preconditioning you use doesn't really matter. So I don't expect you to read all of this, but what this is kind of showing you is that there was no real standout preconditioner in any of this for PET or with SPECT. And then if we look at the convergence over iterations, so on the bottom it says iterations. There were 36 subsets, so this is across 10 epochs. I do apologize that, I know that's a bit confusing. What you can see is that the EM type prior, without completely ignoring the preconditioner, actually did much better in the cold sphere and the hot sphere, which was interesting and slightly disappointing. But in the cold region, did really seem to struggle for PET. And in SPECT, it was broadly similar. So the EM type preconditioner did better in some cases, and the prior air preconditioner did better in other places. One thing to note is that the kind of the block diagonal preconditioner, where we actually did look at these cross-modality, we did include these cross-modality coupling, didn't appear to do any better. So conclusions, the EM-type preconditioner often outperformed the prior air preconditioners. The synergy-aware preconditioner did not significantly outperform either of the diagonal preconditioners. And this is despite the synergy-aware preconditioner costing twice as much as the purely diagonal preconditioners and 6 times more than the purely data-informed preconditioner. So this is quite a preliminary study. So it's only with one quite simple data set So I think the first question is to why did all this happen? Possibly the data set was too simple. So this is a phantom with with regions of very uniform dose. One thing to note is that we didn't include any of the edge regions in the analysis. So this would be just right around the edges of the hot and cold sphere, which is possibly where the strongest modality coupling is going to take place. And thirdly, to say is that what inspired me to start looking at this is that trying to use the EM-type preconditioner for reconstructions with patient data was very, very difficult. So I had to have a very small initial step size with lots of relaxation. So I think probably this whole experiment was using too simple data. Another thing to mention was that we throw away any kind of off diagonals in this big Hessian. So this is kind of the spatial off diagonals with how different voxels interact with each other. And some recent work inspired by last year's Petrick showed that using an empirical weighting factor to account for this was beneficial. So this is possibly something we could look at. And finally, it might be that the quadratic surrogate was just too conservative. So it's updated once per epoch, which means it possibly gets stale. And it might be a good idea to use a tighter alternative. So a diagonal approximation of the actual Hessian of the directional total nuclear variation prior. So future work would be to look at a few of these different things. But firstly, do this exact same experiment on patient data. Don't worry, I got it. Do this exact thing on patient data and a few slightly more complex phantoms that we have some data for. Okay, I'd like to thank my sponsors and